So this is such a cool conference. It's actually much better than most of them that I attend. I attend many medical conferences every year. You see, I'm a doctor, and I'm sick and tired of seeing and treating patients, particularly patients with chronic diseases that are preventable, like diabetes, hypertension, high cholesterol. And I think what we have to start doing is realizing that we are sick people living on a sicker planet. And I think the only way we're going to actually do something is actually practicing sustainable medicine, which is the intersection of food, farming, and health. That's why today I'm speaking to you on this emerging topic that really hasn't been developed. And so what I look forward to is hearing from all of you in how we can actually move this agenda, which I believe is the future of medicine. So you see, I'm a kid from Queens, Jackson Heights, New York, and I was born on top of a bodega. Back in the day, a bodega was not just about candies and fruit juices. It was actually where we picked and bought fruits. And I was fortunate to be raised by these two amazing people, my parents. You see, my mother is from El Salvador and is una curandera. She's a folk healer in our neighborhood. And as a kid, people used to come to our house for her treatments, quote unquote. My father, who my mother fell in love with because he looked like Robert Redford. He has blonde hair, blue eyes, and then back in the 1960s, every woman wanted to marry someone who looked like Robert Redford. So look at this. I'm the product of an El Salvadoran woman and an American father who looks like Robert Redford. So I invite you to come to my house because as a young child, my mother's first words to anyone that walks into our house, and till today, is "Tienes hambre?" See, my mom was very, I think, ahead of her time. She believed that food was medicine, and medicine was food. And therefore, if you feed your kids healthy food, the outcome will be healthy kids. To some of you, it may not sound that outrageous, but unfortunately, what I believe in today's society, we have completely gone away from that kind of notion. And instead of giving a kid maybe some ginger or some aloe vera for a calmante for the stomach, you're going to get a pill. And I think this pill for an ill society that we live in today is not only hurting us, but also our environment. And so this is a common picture of a family feast. We live in New York, right? And it's a small little apartment, a small little house with a small little kitchen, no dishwasher. And my mom was able to make all these things with her terribly arthritic hands. And to today, if you come over the house and it's in Jackson Heights, you will be fed by this wonderful woman. Now, we all heard this, right? An apple a day keeps the doctor away, right? But I want to see if you guys understand this. How many people here, I can't see because of the light, but how many people here have heard of a birthday apple? No one. Okay, maybe things are a little different here in Puerto Rico. So a birthday apple. Now, what do you notice about the apples? They're not shiny, right? I don't know you, but in New York, right, and in the U.S., you can pick up an apple and actually look at yourself in the mirror because it's so waxy. So a birthday apple, so this is a little kind of agro 101, right, from a doctor. So in the U.S. apples are generally ripened between August and September. That's when we pick them. And what happens? We put them away. But before we put them away, we wax, right? We wax this thing so they actually can stay longer and tolerate some of the environments. So now think about this. The reason why they're called birthday apples is because they spent a year, typically, in the U.S., 14 months. A conventionally grown apple is picked, and 14 months later is in your supermarket. All right? I don't think that's a sustainable way of doing things. So now this is a concept that I'd like to share with you. So sustainable medicine is practicing medicine in a way that takes care of people, helps reduce our impact on our environment, and recognizes the impact of the environment on you, on our own health. So like I said before, it's an emerging topic. The reason why I think this is so important is because Nature, the journal Nature, reports that 70% of all cancers are attributed, again, 70% of all of our cancers are attributed to our environment, what we eat, what we breathe. And 80% of heart disease is preventable, but not in what I call our unsustainable systems. See, I think what's fascinating is that we have a parallel problem here. right? And if I can just go through this with all of you in a little bit. So we have a farming and food system, which is most of you here, and me as a doctor in medicine. And so these are the unsustainable problems that we have today, right? We have climate change. We have farming practices that are not sustainable. We do not have biodiversity. We actually introduce monocrop culture. We have tremendous food waste. And in fact, 40% of foods in the US is wasted, right? And I'll talk to you about a little bit later why I think this is a problem. 70% of all hospital food is wasted. We have 80% of antibiotics are given to our livestock, right, so they can live longer and be fatter. So isn't that interesting? So we can live longer and be fatter. That's our animals, not us, right? Pesticides and herbicides are everywhere. The average age of an American farmer is 65 years of age. So who's going to grow our food in the future? The cost of food, especially eating out, is astronomical. Now, that's the problem in farming and food. In medicine, we have a big problem too. The cost of care is unaffordable. It's actually going to bankrupt the US if we don't do something about it. Insurance. Insurance cards don't buy you health care. It buys you insurance. Okay? When was the last doctor that spoke to you about how you eat, how you relax, how you sleep, and how you find happiness? Access to care, more people have it, but more people don't get it. The delivery care is based upon a broken model. You have to be broken to be fixed. It does not focus on health prevention or promotion. The causes of death, as I mentioned earlier, are 80 to 90% preventable and reversible. Patients are not happy with care. I'm not happy being a doctor in this model, and insurance companies are not happy. Last thing, but I think the most serious thing, is that doctors are actually the second most burnt out career in the world, only behind active military and police. 400 doctors kill themselves each year simply because of their burnout. Nurses are not too far behind. So, I leave with the question, as a doctor who has taken an oath to help people, but also, I believe, a community and maybe a planet. So this is the paradox, right? This is, I think, sums it all. So Wendell Berry, an environmentalist and activist who just last year won the President Obama award for civil something. I'm sorry, I can't quote it. But this is it. People are fed by a food industry which pays no attention to health and are treated by a health industry which pays no attention to food. Crazy, right? Throwing agriculture in there as well. So I had an idea. So what if I start prescribing food as medicine? So these are actual prescriptions from my practice that I have actually given to patients. And as you can see, I prescribe whole food, plant-based diets. I call myself a conscious carnivore. I like to know where my meat is coming from if I'm going to put it into me. Just remember, we are what we eat, but we're also what they eat, right? So think about that. Take you one step away from you. So these are actual prescriptions. Eat fruits and vegetables. And you know what? We've actually studied this. Patients that get prescriptions from their doctors are more likely to fill that prescription and adhere to my recommendations. So that was the first part. And then a study came out basically stating that a physician's own health behavior is the greatest predictor of them counseling their patients about a healthy behavior. The example I give all the time, don't smoke. I don't smoke, so therefore I tell my patients not to smoke. I ride my bike with a helmet, so therefore I'm going to tell my patients to ride their bike with a helmet. So what I started doing in 2010 with my wife, we actually took doctors out of the hospital and into the kitchen to teach them how to cook. I firmly believe, my mother has taught me, that you can't learn about food without actually getting into the food. And the only way you're going to learn about food is actually by cooking it. And so this is our Cooking with Doctors program. So I take doctors, practicing doctors in residency during their training, who are at the front lines at our hospitals in America, and teach them how to cook. In the beginning, people said no one would ever show up, right? So for the past 7 years, we've had a group of 13 doctors, Graham's dozen, twice a year, take them out of the hospital and into the kitchen to teach them how to cook. We pair it with wine because wine is plant-based, right? And so this is a selfie we took. And I can tell you, it's one of the most proudful things I've ever done, is actually teaching someone how to fish instead of giving them fish. And so what happened is that I used to work for a hospital system. And so the chefs were like, we want to learn how to cook more healthfully. So what I ended up doing is taking all the chefs from the healthcare system that I used to work for and teach them how to cook plant-based foods. And then this picture came up to me. So in World War II, there were these things called victory gardens. Does anyone have heard of victory gardens? Right? So during World War II, President Truman asked us as Americans to offset the cost of food production going to our military in Europe. How about if we, as a society, grow our own food? Right? So that was victory garden. So the government offside, and I think I would love to, President Trump, if you're listening, I would love to go back to that, give us the opportunity to grow our own food. And so that's what we did, with this motto that if you grow it, you eat it. And so this is a hospital in New York City called Lenox Hill Hospital, where I used to work, abandoned rooftop. We turned that into this. It's a place where all of us hang out. And let me take you into the garden for a second. So everything we grow up there, even what we grow in, is organic, okay? An urban farmer helps us do this. Everything we grow in there, like I said, is respectful of biodiversity. We live in a multicultural world, right? People from Thailand don't use Giuseppe basil. They use Thai basil, right? Mint. There's 7 varieties of mint that grows up there. Basil, sage, all of our herbs. My mom, again, taught me that even a crappy tasting piece of chicken tastes better with fresh herbs. So we start throwing fresh herbs onto everything. And so this is a common day. So these are doctors, nurses, employees, housekeeping, everyone. What I love about it is that everyone gets together. And I think when you start merging farmers, chefs, doctors, business people together, we get a lot farther than just talking to doctors, farmers, and chefs. And again, like I said, burnout is a big problem in healthcare. So my wife's great idea is, why don't we put rocking chairs? I love to see nurses and doctors close their eyes, take off their white coats, and just sit back and relax. Because how can you pour from an empty cup, right? If you're burnt out, depressed, how are you going to give if you can't give anything when you're completely depleted? This is another picture. And so what we ended up doing is that people were like, we want to take some of this stuff home, right? So as you see here, people are gathering. This is the chef right there in the middle. Does this work here? The chef is right there in the middle. So the chef comes out, I come out, and the farmer comes out. And what we ended up doing on Tuesday afternoons is doing Snip Parties, where we actually give patients and staff some samples so they can go home and cook with this stuff. This is me before a Yankee game. Tomorrow in New York City is Jeter Day, by the way. And this is me cutting herbs. I decided not to do the flashy bow tie because it's 100 degrees out there today. And so the last question I want to ask you, so again, I don't know what it is like here in Puerto Rico, but can I just get a sense, how many people like hospital food? All right, good. We're in the right audience. So again, remember I said before, 70% of hospital food is wasted. 70% of hospital food is wasted. 40% of all food is wasted. So therefore, I got another idea. How about if we made hospital food taste better? So that's what we ended up doing. So I started a program called, you've all heard Farm to Table, right? Farm to Table? So I started this thing called Rooftop to Bedside. So as you can see, here's a chef in the morning. Of course, the administrators come out because they want to take a picture like it's their idea, right? And here they're doing Giuseppe basil rooftop pizza. And what they've noticed is that once you do rooftop basil, rooftop mint, rooftop cilantro, rooftop whatever, it increases sales by double, right? So less waste, more people eating healthy food. Again, another chef. And what was amazing is that when we opened this up in 2014, the idea was that maybe some people would hang out up there. one of the biggest problems we have there is now garbage. There's more garbage up there than there is in the cafeteria when there's a beautiful sunny day. And in fact, in 2015, 20,000 people visited Victory Greens. So I think that was a huge success in terms of a movement that I'm trying to build. Sadly enough, in 2016, an administrator, like the ones I showed you before, decided to tell me how to see patients. And they didn't say better, right? Your health outcomes are bad. They said, Dr. Graham, we want you to see patients faster. So I said, go, right? And I quit, right? I just simply believe that better is not faster in food and or in medicine, right? Fast food is not good for you. Fast medicine is not good for you. Thank you. I got 3 minutes left. Thanks. What I wanted to just share with you, and I plant an idea, right? And I think Ken just said it before. You got to think differently, right? And my father always taught me, you know, if you don't stand for something, this is a Malcolm X quote, if you don't stand for something, you'll fall for anything. And I think in medicine, and particularly in healthcare, and in farming and in agriculture, we have to stand for what we believe is right. And I think health is what we're all trying to achieve. But at the end of the day, all we want to be is happy. And so I just want to close with a quote of mine. So our planet depends on the health. Our health depends on the planet, on the health of the planet, and our planet is dependent on our health. Right? I hope what I've done today will inspire you, and not others, to take action and to demand more from our food systems, agriculture systems, and healthcare systems, to allow us the opportunity to be happy, healthy people living on a happy, healthy planet. And I think what we have to do is actually, this is my new company. It's called FRESHMed, right? And FRESH are the pillars of well-being. And it's an RX because it's my prescription to you. So, food, relaxation, exercise, sleep, and happiness. And our motto is, in health, it all starts with food. But at the end of the day, all we really want in life is to be happy. And I am so happy to be with all of you here today. And I think that we all need a fresh start. Thank you so much.